More than a month since he last addressed the pandemic in our state, Governor Doug Ducey's message to Arizonans: keep wearing a mask, keep staying physically distant, keep using common sense, with no strategies to address an ongoing rise in cases. Today, 1,300 cases reported to the state, putting Arizona above 242,000 since the pandemic began.
The governor and state health director, Dr. Kara Christ, say while our cases are going in the wrong direction, Arizona's hospital capacity isn't affected like other parts of the country. ABC 15's Mike Pelton checking the facts on where the state is and where we're likely to go if nothing changes.
Thank you to Arizonans for weathering the storm to date. We know that there is a storm ahead of us, yet it's not here.
But what will stop it? This week, an ASU expert puts the coronavirus case doubling time in our state at 3 weeks, meaning roughly 1,000 cases a day now could be 2,000 a day in mid-November, and so on.
The mitigation that we've put out, the plan that we've put into effect and remains in effect, and I am proud that Arizona is open, that our economy is open, that our educational institutions are open, and our tourist destinations are open. While at the same time, we do have mitigation steps in place that have allowed us to protect lives while protecting livelihoods.
But while compliance measures are in place, unlike the summer surge, businesses are back open. So are schools and universities. The governor does point out the percent of people showing up to hospitals with COVID-like illness is low, around 3%. But in a weekly modeling report by University of Arizona Associate Professor Dr. Joe Gerald, he notes conditions are similar to early June, just weeks before our peak in cases. Quote, given the possibility of exponential growth, current conditions could deteriorate rapidly.
The time is right now to do some additional things. And I'm not talking about big, giant stay-at-home orders, little stuff like a statewide face covering mandate. Simple thing to do, easy to do, would make a real difference.
Will Humble is executive director of the Arizona Public Health Association and our state's former health director.
The governor has a high risk tolerance. He's willing to risk a lot. He's willing to risk, if we don't do additional interventions now, that risks another hospital crisis later on in the fall, which risks another suspension of the operation of bars and nightclubs.
Mike Pelton, ABC 15, Arizona.